So Bob Miller called us today. He's got 200 head of Holsteins and some of them are getting sick. So we're gonna head out to his farm.
Yes.
What's wrong?
The other cows are sick, like this one here. Her milk production has suddenly dropped, and the milk has been thick and yellow.
Is there anything else? How many of the cows were affected?
I've also noticed her udder doesn't look right, and they seem to have labored breathing. And I got about 200 cows in my herd, so 40% is sick. That makes like 80 or something.
Well, the temp is 105. And the udder seems to be a little soft and flabby, and that's common for leptospirosis. Have you had any outbreaks of lepto before?
Nope.
Well, there are several diseases that can cause a drop in milk production, such as lepto, BVD, IBR, and Campylobacter. And I'm also concerned because lepto and BVD can cause abortions too. Have you had any abortions yet this year?
Yeah, about 15 so far, and heifers only.
And have you seen any other signs of disease in the herd? Do you have any sick with diarrhea last year during this time?
Nothing major last year. A few of the calves had respiratory problems, but I wasn't concerned. I haven't noticed any other signs in any of the cattle.
Okay. Well, looking at the past history on your herd, it doesn't seem like anything's changed. You have about 200 dairy cattle and it's a closed herd?
Yeah, we have about 200 cattle, and we recently got some new stock.
Did you quarantine those animals?
Not when they came in.
Okay, have they shown any sign?
Most of them seem healthy, but a couple have been depressed looking.
All right, I'll examine them too. So the cattle that are showing signs, are they mostly older or younger?
I'd say the ones with the drop in milk production are older, but the ones who have aborted are the heifers.
Do you allow your herd to graze?
Yep, they come in at milking time though.
What other kinds of animals do you have out here?
Oh, I see me some skunks and some raccoons and some possums and squirrels and some cats out here too.
All right, can you tell me about the property where they graze?
Well, you can see the pasture over there, and I got a barn right there. And over yonder is a Smith's farm, and he's got some sheep and goats. And about half an acre up, there's a little creek like right there. And then there's my house right there.
All right, I believe you might have some cases of lepto. It can be devastating if it causes an abortion storm, and I just want to confirm that it is lepto, so I recommend that we run a test at this time.
All right.
I'll have my tech get a sample. In the meantime, you and your staff should be cautious around the cattle, especially during milking. It is transmitted through urine, and you can get it in an open cut or somehow if it splashes on your nose or mouth. Are you or anyone else that's come in contact with cattle been feeling sick at all?
Not that I know of.
Okay, you might want to tell anyone who handles the cow to be extra careful, and if they're feeling sick, to get checked out by the doctor.
Okay.
Also, for now, can you isolate the sick animals from the new stock separately?
Yeah, I can keep them in that fenced-in area over there.
Okay. I suspect there's an outbreak of leptospirosis causing abortions in Miller's herd. Send this urine sample to the diagnostic lab right away.
Sure thing, doctor. Which test do you want me to order?
Good question. I think we should do a PCR to look for Leptospira DNA. Because infection with these organisms can often be subclinical and therefore hard to detect, we want to make sure that we use a test with a high sensitivity and specificity. Here, let me explain. So this is a 2x2 table of a hypothetical farm that has Leptospira using the specificity and sensitivity for this disease. What we have here is, in a population of 200 animals, these two numbers right here represent the animals who are correctly identified for the test as being positive or negative for the disease. So these two numbers right here are the numbers that represent false positives and false negatives. You can see that both the sensitivity and specificity for the PCR are very high. This means that the test has a high probability of correctly identifying both diseased and non-diseased animals. We know that the prevalence of Leptospira in cattle in the U.S. is approximately 40%. Based on these numbers, you can see that the test has a positive predictive value of 100%, meaning that a positive test is likely to identify a diseased animal 100% of the time.
I like those odds. I'll get the sample to the lab right away, doctor. The results just came back on Miller's cow. You were right, she's positive for lepto.
Thank you. I have a follow-up appointment with Miller this afternoon. I need to talk to him about his treatment options and come up with a plan to help him keep the disease from spreading to the rest of the herd. So I have a case of leptospirosis at Miller's dairy farm.
Oh yeah? I just read an article about lepto in humans in Mexico. I'm sure you know it's zoonotic.
Yeah, I talked to Miller about it.
In that study, the odds ratio of testing positive for lepto if people were swimming with cattle in fresh water was 1.8, meaning they were 1.8 times more likely to be positive for lepto than those who didn't swim in fresh water that the cattle drank out of.
That's interesting. I know Miller has a stream on his property though. I wonder if anyone plays in it. I told him to take precautions about touching the urine, but who knows how much of a risk that is.
Well, in that study, people who came in contact with cattle urine and had cuts on their hands were almost 5 times more likely to have lepto.
That's crazy. What were the p-values of this study?
Unfortunately, it wasn't published, but it should definitely be a concern because lepto is a zoonotic disease and it's hard to control. It's a lot easier to prevent the spread of zoonotic diseases than to treat it. I did read another study about various housing management methods.
Like what?
Like using concrete floors and whether or not they had access to surface water. Here, let me find that article. Oh, so see, in this study, the odds ratio for the cattle that were housed with a concrete floor is 0.47. That's a protective effect. It means that the cattle housed with the concrete floor were 47% less likely to test positive for lepto compared with cattle that did not have a concrete flooring. And the odds ratio for cattle that were allowed to graze were 2.83.
Maybe Miller should consider not letting the herd out to pasture until we can get this cleared up.
Yeah, and here are the p-values. Both of those odds ratio have a p-value of less than 0.001. This means that the chance of the results of the study occurring due to chance is less than 0.001. And a p-value of less than 0.05 is acceptable to attribute the results to risk factors and not because of pure chance.
But this article is about Tanzania.
Even though that article is about Tanzania, some of the data can be used in the United States. Tanzania definitely has different weather patterns, quality of fresh water, and herd sizes, but it makes sense that those animals that are in contact with contaminated water or are more likely to come in contact with infected animals due to being on a pasture are more likely to get the disease.
True. I'll talk to Miller about his management practices to see if he can change anything that will cut down on the risk of the entire herd getting lepto. Come to think of it, he did mention his neighbor raises goats and sheep and that stream is between their properties. We need to get this taken care of before it becomes a larger problem. Your cattle have tested positive for lepto, and it's important that we hammer out a treatment plan that not only includes treating the infected animals, but also doing preventative measures to ensure that no other cattle on the farm get the disease. Studies have shown that a combination of vaccination and drug treatment has a huge success rate for clearing out lepto.
All right, what do you recommend?
The Lepto Shield 5 polyvalent vaccine is effective with both preventing and treating lepto. The vaccine actually increases the T-cell response, which are the good guys in the immune system, that help fight the foreign agent in seropositive cattle. So I recommend injecting the cows with the vaccine to raise their immune system and combining that with drug therapy. This will eliminate the organism from their systems. We'll use Exceed and Draxin, which are antimicrobials, to clear the organism from the urine and kidney tissues. But remember, with Exceed you have a 13-day pre-slaughter withdrawal time, and Draxin is an 18-day.
All right.
After treatment, our next big concern is to prevent lepto from attacking your herd in the future. If the entire herd is affected, the disease can cause a huge abortion storm, which would have a huge impact on your farm. Though prevention may seem like a cost up front, it will save you money and time in the long run. To prevent lepto in the future, we need to implement a biosecurity protocol. Biosecurity ensures that the disease of the infectious organism are not spread farm to farm or herd to herd. When new cattle come into your herd, you should consider quarantining them for 2 weeks.
All right, but the guy I bought the cattle from assured me they didn't have any diseases.
Well, moving the animals can be very stressful in their life, and any illnesses or clinical symptomology will rise to the surface because they are considered immune compromised at this time. The other owner may not have seen any signs of disease and might have been subclinical before the stress of moving them.
Okay, that makes sense.
You should also train your staff members to learn the signs of the illness or disease so it can be caught quicker and treatment can be administered sooner. Proper vaccination will also provide an added safety feature because it offers a cattle immunity to the etiological agent.
Alright, well, Jill over there is the one that noticed the sick cows, and she's pretty good about keeping an eye on them.
Good, glad to hear it. One more thing which is fairly important. Do you think there is any chance the stream is contaminated? If kids play in a contaminated stream, they could also be exposed to lepto.
I haven't seen any kids in that stream, but I don't really see it once it enters the woods over yonder. But I do know that kids like to play in them woods. So, and as for the sheep and goats, Smith hasn't mentioned anything to me about it.
Okay, well I don't know what kind of relationship you and Smith have, but you and he should probably work together because the sheep, goats, and cows can pass the disease back and forth. Lepto is not a reportable disease, but we might want to call the local health department.
Will that give me any bad press?
I'm not sure you'll get any bad press, but I can make sure of that before I report it if you want.
Alright, that sounds good.
Alright, for now, let me show you the paperwork on vaccination and we'll get started.
Alright.
One more scene and you'll be done.
Get that thing off.
That's so funny.
I'll get his ear.
Duker.